Hi, my name is Terrell Forbes. My partner Zachary Marks and I will be discussing substance use disorder, or SUD, among the adolescent population. Within this presentation, we'll be discussing trends of SUD, types of SUD, the risk and consequences that comes along with SUD, some treatments that can be used to treat SUD, prevention methods, and early intervention for SUD. Substance use disorder, or SUD, is a medical condition characterized by an uncontrolled use of substances like alcohol, drugs, or medications despite harmful consequences. When a person is diagnosed with SUD or experience an SUD, they will keep using even though it's causing disruptions in their everyday life. These disruptions can come in the form of a decline in their health, a decline in their academic status if they're in school, a decline in their work or employment, or a decline in their ability to form or keep relationships. They might feel a strong need, can't stop even though they want to, and feel the need to keep using substances over time to feel the same effects. Oftentimes, if a person quit using the substances, they may feel sick or upset, and it may lead to issues within their mental health. When it comes to SUD, it more than just using. The substance becomes, the substance that the person is using becomes something that they need for their daily function, something that takes control of someone's life. So when someone is going through SUD, oftentimes the substance that they're using takes control of their life and they need it to function. SUD is a multifaceted condition that affects the brain and influences by an individual's environment, genetics, mental health, or trauma history. According to the DSM-5, there are 11 symptoms of SUD. An individual must show at least over a 12-month period to receive the diagnosis. As I said in the last slide, there are 11 symptoms that comes along with SUD. Within those 11 symptoms, they fall under 3 categories. The 3 categories are behavioral and psychological symptoms, risky behavior, and dependence. Under behavioral and psychological symptoms, there are cravings, which is a strong urge or desire to use a substance, loss of control, which is taking the substance in larger amounts or over a longer period of time than intended. So let's say an adolescent starts using alcohol and they tell themselves others that they're only going to use alcohol over the weekends, but then over time they start using alcohol on a daily basis. That is a loss of control. The next symptom is failed attempts to stop. So this is a persistent urge or unsuccessful attempts to cut down or control their use of the substance. Next is time consuming. So this is when the adolescent is spending a lot of time obtaining, using, or recovering from the substance. Next is neglecting responsibilities. So this looks like when an adolescent is failing to maintain responsibilities, whether that might be at work if they're employed, in school, or even in the household. Next is social problems. So this is a continued use of substances despite having a persistent or recurrent social or interpersonal issues caused or worsened by the substance. Adolescent is continuing to use a substance even though that they may be losing friends or failing to maintain or keep relationships, or having disruptions in the household with their parents or their siblings, and they're still continuing to use. Last, within the behavioral and psychological symptoms, so this looks like when an adolescent has stopped participating in activities, whether that might be sports or after-school activities, because of their substance use or because they're diagnosed with SUD. The next category of symptoms is physical and risky behavior symptoms. So the 2 symptoms that fall under this category are use and continued use despite problems. So hazardous use is the use of substance in situations where it may be physically dangerous. For example, driving. So let's say an adolescent has been smoking weed or drinking alcohol, and then they go try to drive. They become a hazard to themselves and whoever may be on the road or around them or in the vehicle with themselves. So that is hazardous use, using a substance even though it may be physically dangerous to do so. The next symptom that falls under this category is continued use despite seeing problems. This is similar problem symptom that was in the behavioral and psychological category, but in continued use despite problems, the difference here is that the adolescent is knowing and seeing that the substance is causing effects and negatively in mental status. So this is them knowing that is worsening their physical and mental status, but they're continuing to use them. The last category is dependence symptoms. So what falls under dependence is tolerance and withdrawal. Tolerance is needing more of the substance to get the same effect, or of the effect with the same amount of substance. So basically, this is when an adolescent starts using the substance in the beginning, but then over time needs more and more and more of that substance to gain that same effect and that same feeling that they felt when they first used it. Or this can look like using the same amount. So let's say a adolescent was only having 1 glass of alcohol when they first started drinking alcohol for a period of time, and they continue drinking that same 1 glass of alcohol as they go along with their substance use, that they're starting to see that they're getting the less effect. So that might be dopamine being released or a gratification that they're feeling within their body, that they're feeling less of that effect over time because of their body is getting used to that 1 glass of alcohol, so that they may increase the number of glasses or the amount of alcohol that they're drinking over time. The last symptom within dependence is withdrawal. So withdrawal is when an adolescent stops using the substance and then they go through negative effects within their body, such as shakes or cold sweats or itching. It's even like sadness or depression because they're used to having that substance, and then they're cutting themselves off of it. So their body's just going through a negative cycle of feelings. And this withdrawal, another key thing to remember is that withdrawal can sometimes cause adolescents or individuals in general to go back to that substance, because a lot of times going through withdrawal is a very hard feeling to go through, so that they may go back to that substance to avoid those feelings. Along with symptoms, there are severity to the symptoms. So there are 3 categories of severity, which are mild, moderate, and severe. So if it's a mild severity, an adolescent may experience only 2 to 3 of the symptoms that I mentioned. If it's a moderate, they may experience 4 to 5 of the symptoms. And if it's a severe case, they'll experience or more of the symptoms. In this slide, I'll be discussing the importance of the topic of substance use disorder among the adolescent population. This topic is really important because when we're in the adolescent stage of our lives, our brains, bodies, and life paths are all still developing. And we use substances at this critical stage of our lives, it can cause roadblocks or disruptions in those developments. It can even lead to long-lasting and even life-threatening effects. As it pertains to brain development, our brains don't fully develop until our mid-20s of decision-making, impulse control, and emotional regulation. Those 3 aspects are governed by the prefrontal cortex of our brains. And when adolescents use substances, can lead to brain development, lower cognitive abilities as it pertains to memory, attention span, and learning, and it also increases the risk of mental health disorders. When adolescents use substances, it can also heighten the risk of addiction. It can developing SUD happens faster for adolescents than it does for adults. This is due to, like I said before, their brains not being fully developed, and as adults we have a lot more experience than we do as teens or adolescents. So adults are much the substance use disorders than a teen or adolescent would. Um, Adolescents often engage in risky behaviors when they use substances or diagnosed with SUD, like binge drinking or mixing substances. Adolescents also struggle with long-term dependence if they were to start early. Component of this is impacts on health and safety. As adolescents, when using substances or diagnosed with SUD, it increases the risk of accidents, injuries, or death, especially from car crashes or overdoses, can lead to unsafe sex, STIs, weakens the immune system, and physical health. Next are the school and social consequences. Adolescents that are diagnosed with SUD often experience poor academic performance, skipping or dropping out of school, strained relationships with family, and their likelihood of getting involved in crime or legal trouble. Adolescents diagnosed with SUD often experience depression and or anxiety, self-harm and or suicidal thoughts, and oftentimes they may use substances or emotional pain, which oftentimes creates a dangerous cycle. So let's say an adolescent has gone through a traumatic experience, so they start using alcohol. That creates a cycle because that trauma is leading to them going to using substances and to other risky behaviors or more mental health issues within their lives. The last aspect is public health and society. Um, Adolescents that experience SUD can lead to increased health costs, so them are at the hospital a lot due to things that are happening because of their substance use. Higher crime rates, so let's say a child is under the influence of substances, they're not in their right mind, obviously, so they may lead to them doing risky behaviors such as committing crimes of addiction. There is a genetic and hereditary effect or aspect of SUD. So if an adolescent is diagnosed with SUD and struggling with using substances, when they grow to become older and have their own children, they may pass on that diagnosis. In this slide, I'll be discussing substance use by the numbers. In particular, the percentage of teens who report using alcohol, cannabis, tobacco, and other drugs. 2 million or 8% of 12 to 17-year-olds nationwide report using drugs in the last month. Among that 2 million, 83% of them report using marijuana in the last month. 7 million 12 to 20-year-olds report drinking in the last month. Among that 7 million, 62% of them report binge drinking during that same period. 8% of 8th graders have used illicit drugs in the last month. By the time those 8th graders are in 12th grade, 46% of them have tried illicit drugs. Lastly, 2 million, roughly 10% of middle schoolers and high schoolers have reported current use of tobacco products. These percentages, along with the graph beside it, just illustrates how big of an issue that this topic is in our country among adolescents using substances or diagnosed with SUD. It just shows that how popular substances are among the adolescents in our country and shows how it needs to be addressed urgently. Along with the percentage of teens using substances that was presented in the last slide, is also important to know the age of first use averages. This is important because as a society, we need to know when children are first using substances and when it becomes educational or informative information about the negative effects of using substance at an early age, such as within the schools or teaching parents when is an important time to tell their children why using substances as adolescents or as children in general effects on their lives. So, on average, an American boy has their first drink at age 11 and age 13 for girls. The average age of first marijuana use among adolescents in the United States is typically around 16 years old. The average in the United States first try tobacco is about 15 years old. As it pertains to cocaine or crack cocaine, the average age of first use is 15 years old. For heroin, the average age of first use is 18 years old. And for methamphetamines, the average age of first use is approximately. Along with knowing the percentage of teens who use substances and knowing their first age of usage, it's also important to know the prevalence of substance use disorder in teens. In 2020, nearly 10 million U.S. adolescents. Among that 10 million, 1.6 million were 12 to 17 years old, and 8.2 million were 18 to 25 years old, have met the diagnosis criteria for substance use disorder, and the majority of them were untreated. There is a higher prevalence of substance abuse among teens. 15% of high school students reported having ever used select illicit or injection drugs like cocaine, inhalants, heroin, methamphetamines, hallucinogens, or ecstasy. Common reasons for adolescents reporting of using substances is to feel mellow or to relax, have fun, help fall asleep, worry less. This is important because, like I said in the last slide, as a society or as a community, in order to address the issue of substance use disorder among adolescents, one, we need to know why they're using substances at the age that they're using and what substances that they may be using, and also the prevalence of how much that they're using that substance. These are all important. These are all important data to know in order to address the issue and overcome the issue. Now, here are the demographic differences among adolescents who use substances or who may be diagnosed with SUD. Historical trends indicate that male adolescents have reported higher rates of substance use compared to the age gap over recent years having narrowed, and women have increased their substance use. The reason why the gap is kind of narrowing is due to the emergence of vaping and e-cigarettes. A big issue for adolescents and high schoolers. They're very, very popular and very, very easily to obtain, whether at gas stations or local stores or things of that nature. So because of the emergence of e-cigarettes and vaping, demographic has been closing the gap on the male demographic as it pertains to substance use. In the race component of the differences, there are significant disparities in substance use among different racial and ethnic groups. Adolescents make up 24.8%. White adolescents make up 24.2%. Black adolescents make up 18.8%, and Asian adolescents make up 16.9%. And the social economics, due to the effects of increased stress, limited access to resources, and exposure to environments where substance use is more prevalent, increases the chances that low-income households will experience substance use abuse. While with the greater access and social pressures often lead to factors for higher income households experience substance use abuse. So this is basically stating that due to many of the stressors, that comes along with low income families, and just dealing with everyday life often leads them to use substances at an early age, while on the other hand, higher income households often experience substance use and with the adolescents due to more um, monetary ability to obtain the substances, as well as just social pressures such as their friends influence them to use substances. The last component here is urban and rural differences among adolescents in urban communities is 26.9%, while in rural is 26.3%. Alcohol, marijuana use in urban communities among adolescents is 22.1%, while in rural is 19.5%. Illicit drug use, adolescents in urban communities are 25.3% and 22.4% in the rural communities. As I'm sure you've read in the previous slides, you're probably pretty well aware of the commonly used substances among adolescents. But here is just a list of them, just so you can see them all together. So we have alcohol, marijuana, nicotine slash vapes, prescription drugs, opioids or stimulants, over-the-counter drugs such as cough syrup, and illicit drugs, cocaine, meth, and ecstasy. So here is just a list of the commonly used substances among adolescents. As mentioned in the previous slide, one of the biggest risks to adolescents using substances is them mixing substances together, referred to as polysubstance use. Polysubstance use is when an individual uses more than one substance simultaneously or one after another. Mixing substances poses a great danger to adolescents due to the stage of development that they are in their lives. Trends of polysubstance use oftentimes looks like when an adolescent drinks alcohol and then smokes weed, but with the rising popularity of e-cigarettes, that oftentimes looks like drinking alcohol and then vaping, or vaping and then drinking alcohol. Earlier initiation of one substance for adolescents increases the risk of using multiple substances in the future. So oftentimes when adolescents use or eat in their earlier years of their life can often lead to them doing other substances as they grow older. Social media and availability of substances online contributes to the higher exposure and consumption. As I said earlier, with vaping becoming so popular for adolescents, and because vapes are so easily to obtain, that often plays a role in why adolescents are diagnosed with SUD or struggle with substance use. Some risk that comes with substance use, combining substances poses a risk of overdosing, increases the risk of addiction, more likely to develop long-term dependence. It is more difficult to treat individuals who are substance use abusers to complicating diagnosis. So when someone uses multiple substances at once or over a long period of time, it becomes difficult for medical professionals or even mental health providers to treat or diagnose that their needs because they're using so many substances at once. In this slide, I'll be discussing the 10-year trends in adolescent substance abuse. Over the past 10 years, there have been a decline in cigarette and alcohol use among adolescents. This is in large part due to the public health campaigns condemning cigarettes and the change in social norms. In 2014, roughly 17% of 12th graders reported smoking cigarettes, while in 2024 that number has declined to 1.7%. As I said earlier, it's important to gain the necessary of the average age of first use for adolescents, the prevalence of what substances that they're using, and why they're using it. This is important for them, for us as a society to know, because once we know this information, go about disseminating public health campaigns condemning whatever substance that we're choosing to condemn at that time, and then also changing social norms, helping people realize the negative effects of these substances, and hopefully that leads to a change in behavior, whether that might be or just declining of use of the substance. Due to the overall popularity of alcohol among adolescents, there hasn't been much of a decline over the past 10 years. In 2014, 55% of 12th graders reported using alcohol, while 42% using alcohol in 2024. I believe this is in large part due to, like I said, the popularity of alcohol, and also because alcohol is oftentimes normal in a lot of households, whether that might be for cultural differences or religious differences. Not abnormal for a lot of households to have their adolescents drink or consume alcohol, whether right or wrong. It's just a very popular substance, so that oftentimes leads to how acceptable it is and how often it's used. Also, in large part due to that it's legal to use as long as you're of age. So alcohol has stayed pretty prevalent over the past 10 years. The next 10-year trend that I will discuss is the rise in vape issues. Vape usage rose from 20% in 2014 to 42% in 2021 among adolescents. There has been a decline in cannabis use among adolescents over the past 10 years. This is due to stronger regulation, stronger laws. It's harder for adolescents to obtain cannabis than it was 10 years ago. Also, emerging trends over the past 10 years is Delta 8 THC, 11% in 2023. Contrum, it's 0.27% reporting use in 2019. Synthetic cannabis use has declined over the past decade due to more known risk of cannabis. Before, not many risks were known, but now there are a lot. Also, as I said before, there are stronger regulations on cannabis, so it's not as easy for adolescents to obtain. Another major component of adolescence and SUD are influencing factors. As we all know, when we were adolescents, we were easily influenced whether to do good or bad things, especially by people we look up to, whether that may be a parent, a family member, a friend, or even within the community. And that still holds the same for substances. Some influencing factors that pertains to adolescents using substances is social media and peer pressure. Social media platforms have played an intricate role to substances through normalizing the behavior. So if we're adolescents, if we're in an adolescent stage of our lives and we see someone on TV or someone in a music video or someone on social media using substances like drinking alcohol or smoking weed and behaviors. Another thing is that studies show that adolescents are more likely to use substances that they've seen their peers do. So if we're hanging out with friends that participate in these behaviors, we're more likely to do the same as adolescents. Another spoke about is the pandemic. The pandemic has played a major role on our society and how things have changed and how we go about our daily lives post-pandemic. COVID-19 increased, which heightened the consumption of substances for adolescents. So during the pandemic, a lot of adolescents were out of school for long periods of time. Often doing school online or through Zoom, and that made it difficult social with their peers, and oftentimes cooped up in the house a lot. So that led to a lot of them feeling alone and sad and anxious and depressed, which caused many of them to partake in substance use to relieve themselves of those feelings, which such as depression and anxiety are linked to substance use. So when an adolescent is diagnosed with depression or anxiety, or let's say that they aren't diagnosed and they go untreated, can often lead them. Here is one of the causes and risk factors for SUD in teens. As I said earlier, the prefrontal cortex in the brain is a very important part of the brain, and it's still developing in our teen and adolescent years. This portion of decision making, and when this portion of the brain is underdeveloped or stopped in its development, can cause adolescents to make poor decisions, have poor control of their impulses, and oftentimes the inability to regulate their emotion. Adolescents more inclined to participate in risky behaviors as opposed to adults with fully developed prefrontal cortexes. Um, this another aspect when it comes to brain development is that as adolescents, our brains are highly sensitive. So whenever we feel the sense of dopamine being released, which is often a component of using substances, can lead to addictive behaviors and increases the likelihood of long-term usage. So when we're adolescents, to control our behaviors once the dopamine is released, and that feeling can become overwhelming and very, very gratifying, which leads to adolescents to continue use of substances because they're unable to control themselves as we are as it's being released, and they're feeling that great sense of just euphoria, and they want to keep chasing that sense of euphoria until they're in a cycle where they're unable to break or very, very difficult to stop. Along with brain development, another risk factor is genetics. Adolescents with a family history of substance abuse or addiction are at a higher risk of using substances than those without the family history of substance use. Um, so if an adolescent has a parent or another relative that struggled with substance use, they're at higher risk of using substances themselves at an early age. Um, Another component, as I spoke about earlier, that comes along with substance use is risky behaviors, like poor parenting if they're abusing or addicted to substances, just poor decision making, and a lot of times that poor parenting, whether it may be neglect or abuse of any kind, can oftentimes cause trauma within an adolescent, which then causes the adolescent to use substances themselves. So even though, let's say, there may not be a genetic reason why an adolescent use substances due to their parents using it, if their parents are now participating in risky behaviors or just exhibiting any kind of parental neglect or abuse to their child, that can also lead to their child participating or using substances and then later on being diagnosed with SUD. Research shows that 40 to 60% of the risk for adolescents developing substance use disorder is related to genetic factors. So about 40 to 60% of adolescents that develop substance use is in large part due to genetic factors, such as them being passed down from their parents or their grandparents or other people within their family history or their family tree. Lastly is the psychological risk factors. Um, a lot of times, as I said in the last slide, trauma can lead to adolescents using substances. Teens who experience trauma are put in a significantly high risk of developing. Trauma includes, as I said earlier, parental neglect or abuse, violence, sexual abuse, etc. So, as I said in the last slide, a lot of times trauma, especially trauma within family units, can lead to children or adolescents using substances as a means. But this also leads to a vicious cycle of abuse because the substance is not curing them from that trauma um, or making that trauma go away forever. It's just putting a band-aid over it and letting them feel like they have escaped it for a little. The sensations of that substance is gone, that trauma is still there, which causes them to keep using that substance, to keep using it as a way to escape, but not fully treating the trauma. Another psychological factor is ADHD. When ADHD is poorly managed or misdiagnosed, it increases the likelihood for alcohol and or drugs. Impulsivity and poor self-control are linked to ADHD, which heightens the use of substances. Next is depression. Teens diagnosed with depression often turn to substance use to manage and or escape the feelings of sadness which are linked to depression. Lastly, there's anxiety. Social fears, constant worrying, and panics are symptoms of anxiety. Substances typically relieves those symptoms temporarily while subsequently increasing the risk of dependence use. Just like in trauma, substances often temporarily relieves an adolescent of whatever symptoms they may be feeling that comes along with ADHD, depression, or anxiety, but those symptoms are only relieved temporarily, or individuals in general don't realize that, and which leads to them continuing to use a substance to keep temporarily relieving those symptoms and feelings, which causes them to have long-term dependence and causes them to have long-term effects on their everyday lives, their work, of employment, or just any facet of their lives in general, as far as maintaining relationships. This is an important topic because we as a community and as a society need to realize that substance abuse has a major plays a role in our adolescents and in adults, but in this particular presentation, we're focusing on adolescents. And in order to treat this issue and combat this issue, we need to realize how big of an issue it is.
Substance use disorders can have serious and lasting consequences for adolescents, impacting nearly every aspect of their development. Because the teenage brain is still maturing, particularly the prefrontal cortex, which is responsible for decision making, impulse control, and judgment. Substance use during this period can be especially damaging. Drugs and alcohol can disrupt brain development, leading to problems with memory, learning, and emotional regulation. According to the National Institute on Drug Abuse, teens who regularly use substances are more likely to experience long-term cognitive deficits, especially when use begins before age 18. Physically, teens may suffer from sleep problems, poor nutrition, and weakened immune systems. There's also a higher risk of accidental injury or overdose. The Center for Disease Control Prevention reported that overdose deaths among adolescents nearly doubled between 2019 and 2020, largely due to synthetic opioids like fentanyl. Substance use is often intertwined with mental health. Teens with substance use disorders frequently struggle with anxiety, depression, or trauma. According to the SAMHSA's 2022 National Survey on Drug Use and Health, nearly 60% of adolescents with substance use disorder also had a co-occurring mental health diagnosis. These struggles often worsen with continued substance use, creating a cycle that's difficult to break without intervention. Academically, substance use is linked to lower grades, poor attendance, and higher dropout rates. The Use Risk Behavior Survey in 2019 found that students reported using marijuana or alcohol the past 30 days were more likely to perform poorly in school. Socially, substance use disorders can strain family relationships and increase conflict with peers. Teens may withdraw from positive friendships and become involved with others who also use substances, increasing their risk of risky behaviors like unprotected sex, unsafe driving, or criminal activity. Involvement with drugs can lead to legal trouble, including arrests and juvenile justice involvement, which can follow a teen into adulthood. Long-term consequences include an increased likelihood of contributing substance misuse, difficulty maintaining employment, and other ongoing health problems. Early intervention can significantly reduce the long-term effects of substance use disorders in adolescents. Creating a supporting environment can help foster recovery and resilience. Emphasizing support over punishment encourages open communication and trust. When a teen is struggling with substance use disorders, treatment isn't a one-size-fits-all. Adolescents have unique developmental, emotional, and social needs, so effective care must be tailored accordingly. Fortunately, there are several evidence-based approaches that can help young people recover and build healthier futures. Behavior therapies are often the cornerstone of adolescent treatment. These approaches aim to change harmful thought patterns and behaviors while teaching healthy coping strategies. One of the most widely used is cognitive behavioral therapy, or CBT. CBT helps teens identify triggers, challenge negative thinking, and develop skills to manage stress and resist peer pressure. According to the National Institute on Drug Abuse, CBT has been shown to reduce drug use and prevent relapse among teens. Motivational interviewing, or MI, is another powerful tool. It's a non-confrontational counseling style that helps teens explore their ambivalence and build motivation to change. This approach respects a teen's autonomy while guiding them towards healthier decisions. Contingency management, which provides tangible rewards for staying sober, has also shown strong results, particularly combined with other therapies. Different types of counseling can support recovery depending on the individual's needs and environment. Individual counseling allows for personalized attention, which is especially helpful when teens are dealing with co-occurring disorders like trauma or anxiety. Group counseling, on the other hand, provides peer support and social learning. Teens can share experiences, learn from each other, and realize when they're not alone. Group therapy can be particularly powerful when focused on shared age-specific concerns. Family therapy is often critical. Addiction doesn't just affect the individual, it impacts the whole household. Family-based modules like multidimensional family therapy, or MDFT, and functional family therapy, or FFT, work to improve communication, resolve conflict, and strengthen family support systems. Research published in the Journal of the American Academy of Child and Adolescent Psychiatry in 2018 shows that the family therapy can significantly improve treatment, retention, and reduce relapse rates. For teens with more severe substance use issues, those struggling to maintain sobriety in outpatient care, intensive outpatient programs or residential treatment centers may be necessary. These programs offer structured environments where teens might receive therapy, education, and life skills training. In some cases, medication-assisted treatment, or MAT, may be appropriate, especially for opioid use disorders. While MAT is less common in adolescents than adults, medications like buprenorphine or naltrexone may be used cautiously under close medical supervision. It's important to note that successful treatment often includes aftercare planning, such as support groups, school reintegration plans, and relapse prevention strategies to help teens maintain progress once formal treatment ends. No matter the approach, a few factors consistently lead to better outcomes. Early intervention, involvement of family and caregivers, treatment that addresses co-occurring mental health issues, and an approach that emphasizes compassion, not punishment. Remember, adolescents are not miniature adults. They require developmentally appropriate interventions that recognize their strengths and capacity to change. When it comes to treating adolescent substance use disorders, both individual and group counseling can play powerful roles. Each has distinct benefits, and often the most effective treatment plans involve a combination of both. Let's look at the strengths of each approach and when one might be more appropriate than the other. Individual counseling offers several unique benefits that make a big difference in a teen's healing journey. First, it allows for personalized treatment planning. Goals and strategies are tailored specifically to each teen's needs, which keeps them engaged and motivated. It also encourages a deeper exploration of trauma, giving teens space to open up about their experiences that might be too difficult to share in a group setting. The privacy and emotional safety of individual counseling helps teens feel more secure and less judged, which is key for honest conversations. And finally, it strengthens the therapeutic alliance that connects between the teen and the therapist. It becomes a foundation of trust, growth, and long-term recovery. Individual counseling can be a powerful tool, especially for teens facing significant emotional challenges. It's especially beneficial for those dealing with anxiety or trauma, offering them a secure space to process complex feelings at their own pace. Teens struggling with shame or trust issues often feel overwhelmed in groups, so individual counseling provides the privacy they need to build their trust for their counselor gradually. For those who need more tailored support, one-on-one sessions allow us to develop personalized coping strategies that set the stage for success in future group work. Overall, individual therapy helps lay a strong emotional foundation, making it a crucial step for many teens on the path to healing and growth. Group counseling offers unique benefits that go beyond what individual therapy can provide. One of the biggest strengths is that shared learning experience. When teens hear others open up about their similar struggles, it can inspire hope and help them feel less alone. Group sessions also promote social skill development. Teens go to practice communication skills, build empathy, and become more confident expressing their thoughts in a safe, supportive space. Importantly, group counseling helps reduce isolation and stigma. By seeing that others face the same kinds of challenges, teens feel a greater sense of belonging and acceptance. And finally, there's encouragement and accountability. Group members can cheer each other on, offer support through setbacks, and help one another stay committed to their recovery. Altogether, these elements make group counseling a transformative experience, helping teens connect, grow, and heal alongside others. Group counseling can be ideal for those who benefit from social learning, who need a stronger sense of belonging, and are open to both giving and receiving support from peers. In these settings, we use tools like role playing to help teens practice real life situations, story sharing to create empathy and deeper understanding. Teens also gain new coping strategies just by hearing how others navigate similar challenges. A key goal is to build a supportive environment, one where teens feel safe expressing themselves, are listened to with care, and participate in group activities that build trust. For teens to thrive in connection, group counseling is not just therapy, it's community, and it's a powerful part of the healing process. Often the best outcomes happen when individuals and group counseling are used together. For example, a teen might start with individual therapy to build trust and address underlying issues, then transition into a peer support group for ongoing support and accountability. Programs that incorporate family involvement, group participation, and individual coaching tend to show the highest treatment retention rates and long-term recovery success, according to SAMHSA's treatment improvement protocol. In the end, the most effective treatment is personalized. It matters most that teens feel safe, supported, and empowered, whether it's in a one-on-one setting or among peers on the same path. When it comes to substance use among adolescents, prevention and early intervention are key. While treatment is critical, the most effective way to combat substance use disorders is to stop it from before it starts, or to catch it early on when support can make the greatest difference. Adolescents are particularly vulnerable to developing substance use disorders due to their stages of brain development. The earlier substance use begins, the more likely it is to lead to long-term problems. According to the Substance Abuse and Mental Health Service Administration, teens who begin using alcohol or drugs before age 15 are 4 to 5 times more likely to develop a substance use disorder later in life compared to those who start after age 21. That's why prevention efforts must begin early and continue through middle and high school. Prevention starts with understanding risk and protector factors. Some risk factors include a family history of substance use or mental illness, childhood trauma or abuse, poor academic performance, and association with peers who use substances. Some protective factors include strong family bonds, clear rules and expectations, involvement in positive activities like sports or clubs, and access to caring adults including teachers, coaches, and mentors. The more protective factors a teen has, the less likely they are to use to engage in risky behaviors. Several evidence-based prevention programs have been proven effective at reducing teen substance use. Life skills training teaches decision-making, stress management, and resistance to peer pressure. Too Good for Drugs is a school-based curriculum focused on building confidence and goal-setting skills. The SBIRT, or Screening, Brief Intervention, and Referral to Treatment, is a powerful tool used in schools and healthcare settings to identify early signs of misuse and connect teens to help. Research published in the Journal of Adolescent Health in 2016 showed that these programs can significantly reduce the likelihood of substance initiation
When implemented consistently, prevention is not just the responsibility of schools, it requires a community effort. Parents and caregivers should talk openly with their children about drugs and alcohol, set clear expectations, and model healthy behaviors. Educators, counselors, and youth workers play a vital role by recognizing early warning signs, such as a sudden change in behavior, declining grades, or social withdrawal, and connecting the youth to supports. Prevention is not about fear, it's building skills and fostering connections and creating a sense of purpose and belonging. As we wrap up this presentation, it's important to remember that adolescent substance use disorders is not a moral failing. It's a health issue that requires compassion, understanding, and support. Here are a few key messages to take with you. Substance use can affect every part of a teen's life, from their brain development to their relationships and future goals. Early use increases the risk of addiction, but early intervention and prevention can change the story. There's no single treatment that works for every teen. The best care is personalized and culturally sensitive and holistic. Teens recover best when they are surrounded by supportive adults, empowered to grow and treated with dignity. If you or someone you know needs support, these national resources are excellent starting points. SAMHSA's national helpline, 1-800-662-HELP, is a free and confidential 24-hour support. Teen Line, you can text TEEN to 839863, which is a peer-to-peer helpline staffed by trained teen volunteers. The Partnership to End Addiction is a family-focused guidance and counseling. Your local school counselor or pediatrician can also help with referrals and screenings. Every teen deserves a chance to thrive, and recovery is possible with the right care, connection, and community. Thank you for taking the time to learn more about adolescent substance use disorders. Let's continue working together to create environments where young people feel safe, seen, and supported.